Hi, everybody. All right, so now we're moving on with our discussion of when do we really need to use pharmacokinetics to get the best result from for our patients. So in this first case, when pharmacokinetic variability is high, in other words, let's remember what pharmacokinetics versus pharmacodynamics is. Pharmacokinetics is the relationship between the concentration and the dosing regimen that we give and the concentrations we see. So in other words, how is the body affecting the drug there, and what's the relationship between the dosing regimen that we give, and not the result we see as far as effects, but the concentrations we see in the body. So is there a lot of variability in patients when we give the same dosing regimen? Do we see a lot of variability in what concentrations we see? That would mean high pharmacokinetic variability. So if we have high pharmacokinetic variability, that means we can't really predict when we give a certain dosing regimen what the concentrations we see will be. So I immediately am thinking, yeah, I'm probably going to, if there's high pharmacokinetic variability, I'm going to want to take a concentration to see how that patient handled the drug and see what the concentrations we get are. So anything that says low pharmacokinetic variability, that means we can predict what the concentrations are going to be. So I'm likely not going to need to do anything with the low variability. See if I can figure out how to use a marker here. There's a pen. So if it's low for the pharmacokinetic variability, I'm not going to need to test because we can predict what the concentration is going to be. But if it's high, then we can't predict it. So we might want to get that concentration to help us figure out what the result is going to be in the patient. Now, remember, pharmacodynamics is the relationship between the concentrations that we see and the effect that we get, right? So this is dosing regimen. I'm going to put dose DR. We don't mean dose rate here, but dosing regimen and the relationship to the concentration. Oh, this is hard to write with this mouse. Okay, so we're really only interested in getting concentrations if we can't predict them. So only when there's high variability. Now, how about pharmacodynamic variability? So if we know the concentrations, how easily are we going to predict the effect? If there's a lot of variability, that means that even if we know the concentration, it's not going to help us determine the effect. So there's no point in getting the concentrations here, right? So if this is high, we're not interested. So we have to have high pharmacokinetic variability because we can't predict when we go from dose rate to concentration what's going to happen. So we're going to want to grab this concentration, but we also want to be sure that there's low variability between the concentration and effect. So the only time we want to the only time it's worth getting a concentration is if there's high pharmacokinetic variability and low pharmacodynamic variability. If this is case, it's totally unpredictable. I can't probably do this with a mouse. Unpredictable. Even with the concentrations. If both of these are low, we're going to definitely be able to predict it without getting a concentration, without concentrations. With this, we would get a concentration that we could predict, but again, it wouldn't be able to help us to predict the effect. So this is unpredictable too. Maybe I'm getting a little better. But if the variability in pharmacokinetics is high, in other words, we can't give the same dosing regimen and be able to predict our concentration. But once we know the concentration, we can determine with some reliability what the effect will be. This is worth doing. So this is where we would where a concentration would be helpful, and we can use our understanding of pharmacokinetics to get the best result for our patients. Okay. Now, we know variability that we see comes from so many sources. You could be genetically predisposed to have more or less enzymes. You could have genetically predisposed to have more or less P-glycoprotein. You could have pharmacodynamic genetic differences. We know diseases like congestive heart failure, renal dysfunction, liver dysfunction, many other diseases can affect pharmacokinetics and pharmacodynamics. We know age will change organ function and therefore act almost like a disease and change your pharmacokinetics. Other drugs, we know we have lots of love triangles involved in pharmacokinetics. So adding or subtracting other drugs or supplements or other things that maybe people don't consider drugs that really are drugs will affect kinetics for sure, and in some cases dynamics. Environmental factors like diet and smoking and air quality, that kind of thing, also can affect your pharmacokinetics and pharmacodynamics, what you eat. So diurnal and variation, etc., all add to the variability that we can see in our patients. All right, that's all we're going to do for this video, and we're going to get into initiating therapy in the next one. Okay, see ya. Bye-bye.